Stop! There is nothing wrong with your device. Do not attempt to adjust your screen. We are controlling the input and output of this program. The hands on the clock are gone, and the hustle and bustle of busyness no longer exists. So take a deep breath and exhale. You are about to cross over into the timeout zone with Dr. Toni, the self-care doctor, for some me time. Here, there is no addiction to hurry, no stress or worry, no strain or pain. Anxiety turns to relaxation, and exhaustion gives in to meditation. Here is where you can just be. Journey weekly with Dr. Toni as she promotes balanced living through information and inspiration while reminding you of your status, that you are a VIP, a very important person in the timeout zone. Remember, take care with self-care. If not you, who? If not now, when?
Hi, I'm Dr. Toni, the self-care doctor with Take Care with Self-Care. Thank you for joining me here on the Timeout Zone, our weekly segment of hot topics. The hands on the clock are gone, and time has stopped so that you can take care of yourself. Well, the holiday season is upon us. It is a time of parties, family gatherings, and tradition, but also it's a time when some people become depressed due to the change of season, maybe missing a loved one, and dealing with feelings of guilt. So today, our hot topic is a part of a series on depression called Defeating Depression Through Mental Wellness. Are you feeling lonely? Have you recently been diagnosed with depression? Are you receiving treatment for depression? Or have you stopped treatment for depression? You see, we all at some point in time have moments of feeling low, but low mood that lingers for days and days and go on for weeks may be a symptom of depression. So what is depression? That is the $1 million question. You see, major depression is an episode of sadness or apathy along with some physical symptoms like fatigue, decreased energy, insomnia, maybe even excessive sleep, digestive problems, persistent headaches, cramps, and an increase or decrease in appetite. What makes it major is the length of time that you remain in a state of low mood. So when it lasts for 2 weeks consecutively and interrupts your daily activities, that is a signal that you really need to get help. You see, major to severe depression disturbs your normal routine and creates an inability to cope with stress, work, or socialize. It is very isolating. You may find yourself pulling the covers over your head, not wanting to come out of your room, just withdrawing from people and the very things that you love doing, you no longer are doing it. Depression is a very serious matter, and it can be accompanied with a sense of guilt, a lack of hope, and recurring thoughts of death or suicide. It is sometimes linked to physical symptoms, although depression is an emotional public health issue. So, let's talk about what depression is not. Depression is not a sign of weakness. Depression is not negative personality. And the good news is that depression is treatable. But without treatment, the physical and the emotional turmoil brought on by depression can derail careers and ruin relationships, especially as people find things more difficult to concentrate and to make decisions. Oftentimes, when you're severely depressed, you'll turn away the very activities that you enjoy the most, including sex. Possible treatments for depression are talk therapy, light therapy, pet therapy, music and art therapy, exercise, support groups, and medication. Depression is one of the leading causes of suicide and suicide attempts. Some of the warning signs include talking about suicide, called suicide ideation, and threatening to hurt someone or hurt themselves, or engaging in aggressive and risky behavior. If you know someone who is suicidal and they talk about taking their own life, please take them seriously. If you are experiencing depression, please get the help. Help is available. If you know someone who is experiencing suicidal ideation, call the suicide hotline. That's the National Suicide Lifeline at 800-273-8255. I hope that this information has been helpful to you. This is a series, and we will have a continuation of other issues regarding depression. But for more information or to refer someone to Take Care with Self-Care, please schedule your appointment and set up an account via our website at takecarewithselfcare.com. I would love to hear from you, so please leave your comments about the video and connect with me on Facebook, follow me on Twitter, or subscribe to my video blogs on my YouTube channel. Be sure to register for one of our upcoming webinars or treat yourself to some intensive time with me via our VIP days, our one-on-one intensives. We also offer other services. But until next time, this is Dr. Toni reminding you that you are a VIP, a very important person. So take care with self-care. If not you, who? If not now, when? See you next week.